Welcome to Smart PT. My name is Jonathan Reimer. Previously, we talked about the dorsal cuboid, how it is an issue or a complication that happens after typically an ankle inversion sprain. So if you can imagine the ankle inverting, of course you're going to damage most likely tissues like the anterior talofibular ligament, possibly the calcaneofibular ligament. But another issue that occurs on occasion is what's called a dorsal cuboid. So while you're inverting and in the motion of spraining the ankle, the peroneus longus muscle will try to contract strongly, and in some cases during that strong contraction, trying to prevent the ankle sprain, it pulls the cuboid dorsally. So if you can imagine, you've got your ATFL pain through this region, but and often overlooked then is this pain produced by the cuboid, also very closely associated in terms of this proximity to the injury. So many times we'll get healing of the ATFL and the calcaneofibular ligament, but the person will still have some lateral foot pain. So you want to maybe consider and check out whether or not they have a dorsal cuboid type injury. So I'm going to set this patient up for a mobilization and or manipulation of a dorsal cuboid. So the cuboid, as we know, we have the calcaneus moving into the cuboid adjacent to the navicular. The cuboid is a bit narrower on top and a bit wider on the bottom, whereas the navicular bone is a bit wider on the top and narrower on the bottom, so it has a bit of a wedge shape to it. But that doesn't really come into play too much because you do have a fair amount of surface on the cuboid on the dorsal side. So what we're saying is that the cuboid is shifted up dorsally because the strong pull of the peroneus longus pulled it up there and it got fixated. So what we're going to have to try to do is mobilize it in a plantar direction, okay? So what I tend to like to do is use a sandbag or some sort of wedge. I'm going to try to block the cuneiforms and the cuneometatarsal joint. And then what I'm going to do is traction the joint between the cuneiform and the cuboid. I'm going to use the pisiform of my other hand, and I'm going to get my body right up on top of the cuboid, and I can either do a graded mobilization here up to a manipulation. So basically that's what you do to restore the position of the dorsal cuboid. Obviously you want to assess joint mobility, things of that nature, to find this problem in the first place, and then you can reassess that afterwards. So I would just basically take the cuboid bone and move it in the plantar and dorsal direction, compare that to the navicular, compare that to the other side. I can also find out from the patient whether they've got a resolution of the lateral foot pain that they were experiencing. Typically post-treatment, there's not a lot of great exercises for this, but I will always tape use first a strip of kinesio tape, pulling that cuboid in a plantar direction, and then I'll reinforce that with a few strips of leukotape for that little bit of stronger reinforcement, and I'll get the person to kind of use that taping strategy, reassess them in a few days, and mobilize or manipulate again if necessary. Typically only takes about 4 to 6 sessions to restore the movement, and then a little bit of time with taping following that to create the stability that you're looking for. All right, have a great day.